Good morning, everyone, and welcome to today's session. The 300 MCQ full-scale grant test that we conduct religiously every Sunday. We have divided that into 6 parts, each containing 50 questions as a quiz. And instead of sitting in a stretch to answer 300 MCQs is a laborious process. So this 300 MCQ full-scale grant test is divided into 650 MCQ quizzes, 6 parts. Each part, let us play it like a quiz. And by that you know how your classmates are playing. And it is not lethargic. You are answering the questions, same time we have a discussion on the questions. So that way, practice become more interesting. And if you happen to take a grand test out of 300, if you are scoring less, you go into unnecessary depression. I don't want that. But at the same time, every Sunday, you need to practice a full-length grand test with all 300 MCQs. And from the past 20 years, it is a clear proof. The guys who took grand tests more frequently are the ones who have ultimately win the game because their physiology is tuned for what the examiner is going to test them, right? So quickly inform your friends that the live quiz show of the grand test has started, and please ask them to join. And if you don't have the link to the quiz, please call our helpline or be part of our WhatsApp group, right? So please be part of our WhatsApp group. So I'll give 5 minutes of time waiting for the players. So already we have some players joining. So, very good. I'm waiting. We have 7 players. I think our people didn't make an announcement. Yes. So we are hoping for more number of students to join the game. I think 8 is a good number. You also please drop a line at. So I hope you all have the quiz link. Do you have the quiz link? Okay, maybe few of you have a challenge of not having the quiz link. I'll try to quickly put the quiz link open. Otherwise, we want you to be part of our WhatsApp group in order to get the quiz link. Wow, good to see Dr. Ashwini, and thank you for a good compliment. Thanks for the precious teaching. Done my MD now, doing my MD now. I'm thankful always. Wow. And thanks for coming to the show. And please inform your friends. Dr. Murali Bharadwaz is an unemployed MD General Medicine, knowing no other job than to spend time with the students so that he lives in this mission and he enjoys only this mission. So, yes. Thank you, Dr. Ashwini. Yes. So, Doctor, let's make the great beginning of the quiz. We have a good quorum of more number of students I wish will join. Already we have 15 players for this quiz, and totally 300 MCQs of the grand test are being divided into 6 parts, each containing 50 MCQs. And we will play 50 questions, have a little tea, spend a good time. Once more, we'll sit for the second fight of tennis game at afternoon 2 p.m. and once more at 5 p.m. and once more tomorrow we will take remaining 150 questions, 3 more parts tomorrow morning. So that way what happens is, suddenly if I ask you to come and answer 300 questions, you feel a big pressure on the mind. And on the top of it, if your scores are going very low, you get utterly disappointed. But 50 questions is a small bite-sized grand test. So once you take bite-sized grand test, it's more easier to stick to the show compliance to taking the mock test. Very good. So let us make the start. Doctor. Question number 1. Thank you so much. Ashwini is full of compliment and adoration. Thank you, Ashwini. Actually, students like Ashwini are the whole inspiration for a teacher like me to remain teaching like a parrot all these years. Because when I look at that satisfaction in your eyes, that you are inspired to become something, a topper, that is the whole driving force, right? So thank you so much for coming, Ashwini, and giving a good compliment. You made my morning. So, doctor, the following muscles are inserted into the dorsal digital expansion of the hand, except the brachioradialis. Why? Because brachioradialis is inserted into the lateral side of the distal end of the radius at the base of the styloid process is what you need to remember. Now, question number 2. Sushant Singh is on the top. Shikhar Dhawan, Suhi, Mercaptopurin, and many more. Good. Please inform your friends that the live quiz started. Question number 2. These are all attached to the coracoid process, except. So, very good. 3 of you correctly answered, except the long head of the biceps brachii, because long head of the biceps brachii is attached to supraglenoid tubercle of the scapula, is what you need to remember. That keeps Sushant Singh and Suhi, JD, on the top. Now, question number 3. This is all true about the lumbricals, except. So you should know anything about the lumbricals, about their function. So, yes, lumbricals cause flexion at the metacarpophalangeal joint. You make your fingers like this, L shape. So, metacarpophalangeal flexion, extension of the interphalangeal joint, that constitutes lumbricals. And they arise from the tendons of the flexor digitorum profundus. They're all not bipennate. Only first and second are unipennate. Third and fourth lumbricals are bipennate. That's the point you need to appreciate. That's good. That keeps Sushant Singh on the top. Question number 4. All these structures, they open into prostatic urethra. So, the only one that opens into spongy urethra, about 2.5 centimeters below the perineal membrane. What is that structure? That is right. Only 3 are right. Bulbourethral glands open into spongy urethra. Only Albus correctly answered. Bem also correctly answered. YY also. Super duper. Now, question number 5. These neurons of the cerebellum form the inhibitory synapses with Purkinje cells. All of them, except. So, which are excitatory, which are inhibitory? On the Purkinje cells, you have to be very sure. So, the parallel fibers of the granular cells, they form the excitatory synapses with the distal spine of the spiny branches of the Purkinje dendrites of the cerebellum. So they don't form inhibitory. Granules are excitatory. Granules are excitatory. That's good. Now, Dr. Sushant correctly answered. Question number 6. You know, the pterygomandibular roughing. It is a useful landmark in the oral cavity. So, there are two muscles which form the tendinous tissue marks. It is the two muscles whose juncture marks this landmark. So, what are those two muscles innervated by? It is the facial and the vagus is what you need to remember. So, once more, this is a out of the zone question. Now, question number 7. With regard to the bronchopulmonary segments, what is true? Bronchopulmonary segments. So how do you identify and separate these bronchopulmonary segments? It is the veins that can be used to localize the plane between the segments. So remember, doctor, bronchopulmonary segments is one of the favorite topic. So you have done this question wrong, no worries. But you recognize one point. What is that? In the NEET PG FMGE examiners question bank in the server, in the examination server, bronchopulmonary segments is a highly topic. After this quiz is over, you should go and have a more detailed discussion on the bronchopulmonary segments in the onlineMBBS.com video library. Good. Only Sushant correctly answered. Question number 8. Yash Ramaraj is saying, sir, very long options in 12 seconds. That is the whole fun. You should get the practice to sniff, to quickly catch in the middle of that pressure zone within 12 seconds. Very good. 7 of you rightly answered. So, you need to remember, all the patient's clinical symptoms are pointing towards carpal tunnel syndrome, which is the median nerve compression, is what you have to remember. Good. DK, Sushant Singh, Suhi, all of you are absolutely right. Question number 9. The anterior cerebral artery supplies the medial and orbital portions of the frontal lobes. And if at all there is an occlusion of the artery distal to the anterior communicating artery, what does it lead to? Absolutely. Always remember, ACA, anterior cerebral artery strokes lead to contralateral lower limb weakness, is what you have to remember. Good. Mercaptopurine and Sushant Singh are on the top. Now, question number 10. A patient with rheumatoid arthritis, he will exhibit which joint changes? Yes. So what are the joint changes? What is the important joint changes? Absolutely. Very good to see 18 online players. So please inform all your classmates, doctor. See, the NEET PG full-scale grand test is 300 MCQ test. We divide that grand test into 6 parts, each part containing 50 MCQs. So 11 a.m. on every Sunday, 2 p.m., 5 p.m. We finish 3 parts. Once more on Monday, 11 a.m., 2 p.m., 5 p.m., we'll finish another 3 parts. So instead of giving you all 300 questions at a time and force you to answer, and you will go into postponement syndrome. Bhaiya, my psychiatry nahi pada, my ye nahi pada, wo nahi pada, and that will unnecessarily create a delay. We don't want that. Because though we all subscribe to online tests, we procrastinate. We don't take them. We pay money like a Tirupati Hundi to the Lord Balaji, but we don't really sit and take the test full length. Instead, if we divide this into 6 bite-sized 50 question wala tests, my feeling is all of you will get into that habit of taking the every Sunday full-scale grand test. That makes a huge difference when it comes to how many grand tests you have solved. Makes a huge difference in the tomorrow's ultimate NEET PG exam performance. Very good. Now, good, Sushant. Next, question number 11. Hydroxylation of proline and lysine occurs in Golgi apparatus. Oh, I'm sorry. So, in the synthesis of the collagen, where does the hydroxylation occur? Not in the Golgi, it is a smooth rough endoplasmic reticulum where you have the hydroxylation enzymes. That's the point we wanted to emphasize. Now, question number 12. The reticular fibers of lymphoid organs, what are they made up of? So, typically, the reticular fibers are made up of type 3 collagen is what? Actually, it is type 1 should be the correct answer. Yeah. A small error in the key. Yeah. Question number 13. Priya suffered a mild CDA. She has right-sided weakness with spastic paralysis of her extremities. What is the possible site of her lesion? Spastic paralysis of the extremities. Absolutely, it is the left frontal lobe because she has got right-sided weakness. Simple question. Good. Shikhar Dhawan is batting very well. Now, question number 14. Yeah. So, question number 14. The patient has a motor deficit on the right side of the body, decreased sensation and pain on the left side of the body, and also diminished vibratory and position on the right side of the body. So, typically, it is the right hemisection of the spinal cord, the brown sequin. Good. Albus is the only guy who correctly answered. So localization of the neurological lesion is a favorite area of the examiner. A physician examining a neonate is startled to find that squeezing the infant's shoulder with his hand can bring them nearly together in front of the body. So, congenital absence of what will lead to it? Absolutely. Clavicular dysgenesis is the underlying cause. Good to see 20 players fighting for the top position. Now, if the plasma sodium is 135, glucose 400, blood urea 120, what is the osmolarity of the plasma? So you should know the formula in order to answer this question. 2 into serum sodium plus blood urea nitrogen divided by 2.8 and glucose in milligram per deciliter divided by 18 will give you the osmolarity, doctor. So 2 into 135 plus 56 by 2.8 and 400 by 18 typically will give you 310 as the value. Good. JD is correct. Now question 17. The membrane potential of the cardiac muscle is most affected even by a small concentration, small change in concentration. So who decides the resting membrane potential? Absolutely. It is the potassium that decides, not calcium. Wow. See, such a simple question, but clean bold. Great. Shikhar Dhawan is making very good scores. Suhi also. Great. Question number 18. What statement is incorrect with regard to isometric? You know, you need to go through the smartphone, doctor. Then only you can see all the options in totality. Absolutely right. So, muscles can lengthen while doing work. All of you know, work is equal to force into length. So, there lies the important clue. Now, that's amazing. Mercaptopurine picking up very fast. So, which is an excitotoxin among all this? Yes, which is a excitotoxin. Typically in motor neuron disease, it is responsible for causing all the damage. Absolutely. It is the glutamate is what you need to remember. Great. Question number 20. If the total lung volume is 6 liters, at the end of normal expiration, how much of oxygen is present in the lungs? So, 9 of you correctly answered. That's amazing. So, FRC, functional residual capacity, is equal to 2300. 16% of it is oxygen. So 16% of 2300 is equal to 370 ml. That is the solution for the question. Question number 21. Now, about the pH. So, pH of the blood, pH of the urine. So, you have to be very sure. If you are regularly seeing the complete urine examination report, you will answer this question correctly, doctor. So, pH of the urine is usually less than 7 is what you need to remember. Once more, inability to acidify the urine. What is it a very important clue for is what you need to learn. Right? So, question number 17. What is false about lymph? Great. So, lymph is having plasmaproteins. Whenever you increase muscular activity, production of the lymph also will increase. They're all the true statements. Now, the next question. Question 23. With regard to the thirst, what is the wrong statement? So when do you feel thirsty? When you are dehydrated. When you are dehydrated, you will try to retain water. So to retain water, what do you require? There is a clue. Absolutely. There's an increase of the ADH when you are thirsty because of dehydration, not a decrease. Super. I'm surprised Sushant didn't answer. But DK, Suhi, Bemma, HN, Bobby correctly answered. Good to see 21 players taking this grand test. Superb duper. Question number 24. Now, hemolytic disease of the newborn. What is true? About the hemolytic disease of the newborn. Yeah, that's right. So you can prevent it by injecting the mother with anti-D agglutinins after the delivery, which is a true statement. See the options when they are very long, no? You can't see them on this YouTube display. But on the smartphone where you are playing the game, you see all 4 options. That is the reason I want all of you to be part of our quiz WhatsApp group. Already there are about 170 members in our WhatsApp group, and the list is growing big. So I want you to be part of it. Get an alert notice that the quiz is going to start so that you're all brimming with that energy. Great. This is a very rewarding round because a good number of you correctly answered. Question number 25. What will be greater than normal in a patient with low V by Q ratio? Low V by Q ratio. Yes. Oh, only 3 of you rightly answered. See, low V by Q ratio obviously will lead to lower amount of partial pressure of the oxygen. So that is the reason the alveolar arterial gradient, that is the amount of oxygen in the alveolus and the amount of the oxygen that diffused into the artery, the gradient, typically increases whenever there is a low V by Q ratio, which lead to a significant hypoxemia, is what you need to remember. Good. But the earlier question was a very logical question. Very good, Ravi, for answering that. DK also. Now, question number 26. The greatest increase in physiological dead space. It is expected in which situation? Physiological dead space. Easy question. You can easily answer it. But I know what is the wrong answer. Yes. Atelectasis, pneumothorax, bronchoconstriction. Is it physiological dead space or anatomical dead space which become altered? So it is in the pulmonary embolism. Now, Good. Only Ravi answered it correctly. Good, Ravi. Now, Sca Node Cells. So, what are Sca Nodal cells? So, why Sca node is a pacemaker? Great. Because it can be able to generate the impulses because the membrane potential is unstable. That's the reason Sca node can generate has the pacemaker activity. Great. Question number 28. As the people keep aging, there is usually a decrease in all these parameters, except as the people keep aging. Super. So the lung elasticity will decrease. Resting arterial PO2 decreases. Percentage of the vital capacity, that is FeV1, which is forced out, also decreases. So only Sushant and Markap didn't correctly answer. Now question number 29. Intestinal secretions, what do they contain? Intestinal secretions. Great. The enzymes that hydrolyze the disaccharides are the ones which are there in the intestinal secretions. Good to see 22 online players. So once more, doctor, let me tell all of you, please come afternoon 2 o'clock, we will have part 2 of 50 questions. Once more, evening 5 p.m, we have part 3 of 50 questions. So, of the grand test. And tomorrow, remaining 150 questions in 3 parts we will finish. So, Sunday, Monday should be dedicated for full-scale grand test, so that एक चक्कर मारना है, पूरा घूम के आना है 300 questions को. Like that, if you are doing it every Sunday religiously in the next 5 months, nobody is going to stop you to become a winner. Right? So please tell your friends and also bring some more friends to play and become a winner. Every time you become a winner of any of the tournaments, we conduct almost all 1,000 tournaments in a year. Almost every day, 2 to 3. So we give to 1,000 students a free online subscription of onlinembbs.com, video library, grand test, notes, everything. So that is Dr. Murali Bharadwaz Super 1000 batch. So to become part of that, you need to keep playing the quizzes, compete with your classmates, Spardaya, Vardhathey, Viday. Now, the next question, Doc. Question number 30. What is wrong about free fatty acids in plasma, FFAs? Yes. So, what hormones lead to lipolysis, lipogenesis, and accordingly? So, you should remember, FFAs account for less than 10% of the total fatty acids in plasma. They bind with plasma proteins that can be metabolized to release the energy in the cardiac and skeletal muscles. In fact, if you take cardiac muscle, the predominant source of energy comes from fatty acid oxidation. So you should know adrenaline will make more FFAs to become released. That's good. Now, question number 31. with lactose intolerance. So which type of chemical bond they have a problem to split? Yani, which enzyme is missing? Absolutely. It is the glycosidic bond which is deficient. Now, question number 32. A couple have 6 children. All of them exhibit a short stature, eyelid droop, some degree of muscle weakness, hearing loss. And the mother also had such problems at a mild level. So maternal inheritance is basically mitochondrial is what you need to remember. Great. Sushant and Ravi are closely with loggerheads and a fist fight to become a winner. Now, spontaneous deamination of certain bases in the DNA occurs at a constant rate. Which deamination will lead to a mutation in the resulting protein if it is not repaired? Absolutely. Cytosine to uracil mutation, if not repaired, can lead to the damage. So, a bit tough question, but it's okay. So, if a HIV positive individual is placed on monotherapy, what is the main genetic mechanism leading to the resistance to the antiretroviral drugs? Is a very important question. Yes, it is the lack of the error checking in the RNA polymerase which is mainly responsible for antiretroviral drug resistance. Good. Now, 35. A chronic alcoholic has been only drinking for the past 2 weeks with nothing to eat, is found unconscious with hypoglycemia. Oh, come on. Why alcoholism lead to hypoglycemia? That means gluconeogenesis should get inhibited. So that happens because alcohol metabolizes to form acetyl-CoA, which lead to high NADH by NAD plus ratio, and that is an inhibitor of the gluconeogenesis. That's the reason there is a hypoglycemia in an alcoholic individual. So we discuss this in a more detail in the biochemistry in the online MBBS.com video library. Now, question 36. A patient is found to have a rare hemoglobin abnormality that decreases the P50 for the hemoglobin from 26 millimeters mercury. What will happen to this individual? Yes. So typically that state of hypoxia stimulates the RBC production. So polycythemia will occur because of the constant hypoxic state stimulating the kidney. Question 37. A 35-year-old male accidentally exposed to nitrates presents with anxiety, weakness, dyspnea, headache, and it is not corrected by oxygen supplementation. So, in this given kind of situation, what type of hypoxia it is? So, this is that kind of hypoxia where partial pressure of the oxygen in the arterial blood will be normal. anemic hypoxia, histotoxic hypoxia, what are the differences between them? There is a table which we discussed earlier. Please kindly review that. 38. Which is the site which is responsible for amino acid binding in transfer RNA, tRNA? Yes. So where does amino acid bind? It is to the 3 end of the tRNA. So you should know the tRNA structure. One question on RNA, DNA polymerase invariably comes. Tomorrow's NEET PG. Now, question number 39. Pantothenic acid. It is necessary for which metabolic step? So all these vitamins, coenzymes is a favorite topic. Great. For the oxaloacetate to citrate conversion. Good to see 24 players. Even if you joined little late, you can continue to play, Doctor. Harsha, Nasir, Liaquat, Swati, Ritesh, Rajita. Whoa, that's great. Now, question number 40. Now, a sample of liver parenchyma is homogenized to remove the membrane components and organelles, leaving only the cytosol. So you should recognize what is a cytosolic protein. Transketolase. So you should know which components are there in the cytosol, mitochondria, which reactions occur in cytosol, mitochondria. You got to be very sure. Question number 41. Thiamine deficiency can be measured, diagnosed early. How do you diagnose? What is that important enzyme? Easy question. Most of you will correctly answer. Great. Erythrocyte transketolase activity. I'm surprised why 5 of you have answered option C. Otherwise, a very easy question. Good. Question 42. A 35-year-old female is hospitalized with headache and vomiting, a long history of psychiatric illness, and she is known to practice eccentric dietary habits. And there's a papilledema, dry skin, hepatosplenomegaly. So all this is because of vitamin A overuse lead to pseudotumor cerebri. Good. Question number 43. A 56-year-old homeless, increased fatigability, exertional dyspnea, lower extremity edema, decreased sensation on the ankle and feet, subacute combined degeneration of spinal cord. Is it that? Or there's a cardiac dilation, increased cardiac output, so very, so thiamine, very good. Super. Now, question number 44. Cultured fibroblasts taken from an infant suffering from hypotonia shows a inability to oxidize very low fatty acids and phytanic acid. Where are these things metabolized? Easy question. Gummy. Peroxisomes. How come only 4 correctly answered? I can't imagine. Ravi Kumar, I expected to answer that question correctly, peroxisomes. Now, a number of different alteration can occur in cellular DNA, which can be repaired by DNA repair mechanisms. So, yes. So, you should know everything, anything about Xeroderma pigmentosum, right? Now, great. Shikhar Dhawan made a zigzag. Question number 46. Most drugs gain entry into the cells. How? What's the mechanism? Most drugs gain entry into the cells. How? Absolutely. It is the first order kinetics, and it is by passive diffusion, is what you need to remember. Now, good to see 24 players. I want all of you to come and bring another 25 players for our afternoon 2 p.m. part 2. So totally 6 parts, we divide this 300 MCQ grand test. 47. If a drug is known to be distributed into total body water, what is the dose needed to obtain a initial plasma level of 5 milligram per liter in a person who is weighing 70 kgs? 70 kgs. So this is a question about loading dose. So loading dose is equal to volume of distribution into plasma concentration. So this man weighs 70 kgs, 60% is total body water. So 42 liters. So the volume of distribution is 42 liters into 5 milligram per liter. That is equal to 210 milligrams should be the loading dose. So if you know this formula, you are through. But you don't know the formula, you need to know the formula. Now you know that loading dose is equal to volume of distribution into plasma concentration. Badhiya. Good to see 25 players, little late but latest arrival. Question number 48. A woman is taking OCPs. Which drug is unlikely to reduce the effectiveness of OCPs? Super. So you should know what are the inhibitors, inducers of P450. Good. Sushant, Ravi, Shikhar, all of you are right. 49. Last 2 questions to decide who is the 40,000 rupees winner. Neostigmin differs from pilocarpine. How? In having effects on what? Right. So the pilocarpine activates M receptors, muscarinic, not nicotinic. Whereas neostigmin acts on the nicotinic receptors. So skeletal muscle is nicotinic receptor on which the pilocarpine has no effect. That is the point. Let me see who answered this correctly. Hey, Sushant, Ravi. And liaquat, excellent. This is completely a proper conceptual question, doctor. Last question before we sign out. What is the most appropriate drug to use for the patient in the parenthesis? So drug of choice for the given scenarios. Great. So ACE inhibitors are good to prolong the duration and prevent the development of diabetic nephropathy is what you need to remember. Super duper. Sushant Singh is the winner. Sushant Jindabad. Sushant Jindabad. Excellent, Sushant. We are very proud of you and we wish to see Sushant becoming the future NEET PG topper. Take a screenshot, send it to our helpline, and 40,000 rupees worth onlinembbs.com video library with 3,000 video lectures, 1 lakh PowerPoint slides, and 30,000 MCQs, topic-wise classified into 953 high-yield topics, and 65 full-scale online grant tests and discussions, and Murali Bharadwaz, all yours. So, Sushant, very good. And everybody else who joined the quiz a little late, but latest. So, yeah. Late but latest. And guys, quizzing, small quizzes, bite-sized. Ideally 20 questions is the maximum attention. Okay, 50 is tolerable. So 300 MCQs of the grand test is being now divided into 6 quizzes of 50 questions. Every Sunday, 11 a.m., 2 p.m., 5 p.m. Once more Monday, 11 a.m., 2 p.m., 5 p.m. With these 6 discussions, we finish solving the grand test every week, right? So that is a deal. Please tell your friends that afternoon 2 p.m. once more, we are all meeting. Enjoy a great preparation. Good luck. So Yash Ramanaj is asking, sir, please give 90% off for the top 10. Why not? The deal is on. You can give a call to our helpline and tell I am in the top 10. But today only you need to pay and join. That is a small caveat and condition of the deal. Okay? Yeah. Please call our helpline to buy the subscription, Ramanaj.